Welcome to CyberCast, decoding today's cyber issues. I'm your host, Nikki Henderson. Today, we're chatting with Andrew Carney, the Program Manager of Resilient Systems at the Advanced Research Projects Agency for Health. He will discuss the agency's new upgrade program that offers healthcare organizations a way to automate cyber solutions to defend their IT systems against ransomware attacks. Andrew will also talk about how the Digital Health Security Initiative is helping ARPA-H tackle data vulnerabilities and how the agency is teaming up with DARPA to expand the Artificial Intelligence Cyber Challenge. Today, I'm speaking with Andrew Carney, the Program Manager of Resilient Systems at the Advanced Research Projects Agency for Health. He will outline some of the top cyber priorities at ARPA-H and share details about new programs that will help better identify vulnerabilities and boost resiliency. Andrew will also talk about the agency's latest collaborative effort with DARPA. Hello, Andrew, and thank you so much for joining us on the show.
Thank you so much for having me.
Andrew, can you please start off by giving a brief description of your role at ARPA-H and also talk a little about some of the agency's top cyber priorities?
So I am a program manager at ARPA-H. I manage a portfolio of research efforts focused on cybersecurity for healthcare. And, ARPA-H's presence in this space, our work focused on securing the nation's healthcare infrastructure, is a relatively unique thrust as part of our overall agency goal to provide better healthcare for everyone. The way that we receive care today in the United States relies on a lot of technology. And so securing and making sure that that technological infrastructure is stable is a major component of our work. And generally, cybersecurity in healthcare is uniquely challenging. It's an extremely resource-strapped sort of environment, potentially. Like, we want to focus on care. Every dollar we spend on IT security is one less dollar that we spend on doctors or nurses or other clinical staff or capabilities. In addition, the technology environment is extremely diverse. We may have hundreds of different vendors represented across all of the devices in a hospital. That means that managing each of those devices from a cybersecurity perspective, each device may require its own treatment. Now, this is very different than a lot of enterprise situations where you have largely the same types of devices or machines running in your system. In a previous role, when I was in industry, I was dealing with over 1 million endpoints every day, but most of them were Windows machines or Linux servers. I knew they all looked the same. They shared the same characteristics. And so determining how to best defend them, determining how to best address the security issues that we might run into with them, we got a lot of we were able to scale our approaches very quickly. In healthcare, we may have to have more customized solutions addressing each of these different devices and their own unique needs. So it's just, there's a lot more complexity in this space. And there's very little tolerance for downtime, whether or not that's downtime because of you're replacing hardware or you're patching software. If things are currently working well enough, it's very hard to sort of make the case that we need to, take things offline to improve them. And ideally, we'd be able to improve them so quickly that they wouldn't have to come offline for very long. So, those are some of the challenges that we're dealing with in this space and that we're thinking a lot about.
Okay, perfect. Thank you so much, Andrew. I appreciate that. Well, what is the Universal Patching Intermediation for Autonomous Defense or upgrade program, and how is it preventing malicious actors from disrupting healthcare frameworks and patient care?
So Upgrade is about creating an autonomous cyber threat solution that ultimately enables proactive, scalable, and synchronized updates of an entire hospital's technology ecosystem. One of the challenges we have in cybersecurity is that there's an inherent asymmetry where attackers only need to be correct once to get through a defense. And once they're inside your system, it's very difficult to remove them. Defenders have to defend every possible threat, every possible attack. And this is a huge challenge. And hospitals with this complex ecosystem that I was just kind of talking about, it makes it even more challenging. So with Upgrade, we're hopeful to create novel solutions that both automate this for under-resourced IT teams and also provide the sort of confidence and prioritization to decision makers in a hospital or clinical environment that it's the right decision to update this device. And here, let's help them do that automatically. According to Mandiant Security, I think something like 30% of all ransomware attacks are the result of a novel vulnerability being exploited to gain access to a system. And healthcare is the number one or number two, depending on how you stack them, target for ransomware threat actors, at least this year. So, if we're able to keep these systems up to date, if we're able to reduce the cost and time of ensuring that they're updated, we will reduce the number of attacks and sort of increase the ability to improve these systems in the future. Patching isn't just necessarily security updates, right? It's fixes for other things as well. It's upgrades. Sort of cheekily come back to the title.
Mm-hmm. Right. Okay. Well, Andrew, what are some of the other types of IT tools that Upgrade is creating to help boost cyber resiliency at medical facilities?
So we've identified a few critical areas to address with Upgrade. And we've separated these as our technical areas, as the different kind of research thrusts for the program. And the first technical area is focused on what the IT teams use, how they manage their own systems, their own devices. And so the idea of having a vulnerability mitigation platform that does not necessarily replace the tools that the hospital may have already deployed, but fills gaps not filled by current commercial tools, and then orchestrates and reduces the labor and friction required by the existing IT teams to leverage to use these systems. So, thinking about upskilling the IT team, increasing their capabilities and capacity with this platform, that's a primary goal there. Our second major thrust area is focused on emulation of hospital equipment. So creating digital twins with sufficient fidelity that we're able to test the security properties of a device. So it can be very challenging with hardware to perform this testing. In fact, even manufacturers, it's a considerable investment to instrument and sort of test hardware. And so we are looking at ways to digitize these devices, create this digital twin, and then that would enable us to test medical devices the way that we test most of our other commodity software, which is in the cloud in large kind of compute clusters where we're able to take digital representations of things and sort of submit them to the multiverse of potential conditions and tests that we would like to. The third thrust area is focused on sort of discovering vulnerabilities in healthcare systems. And one of the unique elements here is that we're looking for folks to study how experts reason over software when they find vulnerabilities. We're looking for them to build mental models of how expert hackers today do this very involved, challenging task, and use that study to inform better detection so that we can really intrigued by this idea that if we understand how human experts do this better, that we'll be able to create automation that's far more performant than what we have today. And then the final thrust area is focused on how do we get, develop remediations, develop patches, develop remedies, develop ways of defenses effectively. How do we develop defenses and get those for the threats that we find? Can we assess in real time if a vendor's patch for a given device or issue is sufficient? If not, can we place other compensating controls in place automatically to deal with that? What if there is no patch? How do we empower the IT teams both by creating options for them to consider and then helping them, with the different sort of pros and cons of each option? So when we put all of these ingredients together, we're hoping to thoroughly empower sort of hospital IT teams to better manage and defend this very complex and important environment that they're charged with securing.
Oh, thanks, Andrew. I appreciate you outlining those IT tools that will help enhance cyber resiliency. Now, there's another program that ARPA-H launched last year called Digital Health Security Initiative, or DIGIHEALS. Can you tell me more about this effort and what progress has been made in addressing vulnerabilities in data security?
Yeah, absolutely. So DIGIHEALS is about capitalizing on work that we've seen from the DoD that we recognized was being used to secure systems for defense purposes. And so we asked ourselves, well, okay, what would it take to get those technologies, make them viable, and also, refactor and adapt and sort of develop them so they could have a sort of revolutionary impact in healthcare. And so part of that is, there are these technical research challenges that are different between the defense space and healthcare. And then the other piece of it is cost. The pressures and the challenges. It really changes what's viable. And so we identified a number of potential technologies and sort of areas to address, and been very happy sort of as we've been developing that work over the last year.
Okay, great. Well, how has ARPA-H, have they experienced any major challenges since launching Upgrade or DIGIHEALS? Can you talk about that?
I would like to add maybe something to my last answer, if that's all right.
Oh, sure. No problem.
DIGIHEALS is a really interesting program in that we have performers looking at a number of different areas of work. So we have a performer focused on making the changes in software more scrutable, more understandable, sort of to in natural language, so that we can empower decision makers who are not software engineers to determine if a software update, or if they're comparing two different products to purchase, what are the technical sort of elements of this software under the hood, and can we lay those out in a way that's clear to a non-software engineer, such that they can evaluate it quickly and sort of decide, well, there are risks here, like there are security issues here with this tool that may not be apparent unless you did perform kind of deep program analysis on it. And so lifting that description is something that we're excited to see kind of continue to develop. And then another of our teams are actually led by two clinicians out of a university hospital, and they are taking a really interesting approach to resiliency to cyber attacks, and how you sort of address every element inside a hospital, from sort of procedures for staff to physical and or the IT infrastructure, and even just the getting a better understanding of the impacts and the frequency of these sorts of attacks in healthcare. So very, very excited for that team's work as well.
Great. That's good to hear. Has ARPA-H experienced any major challenges since launching Upgrade or DIGIHEALS?
So I think we wouldn't be doing our jobs correctly if we weren't encountering major challenges. I think being at an ARPA, being focusing on ARPA hard sort of problems, necessarily we encounter challenges with what we're trying to do. And then that's compounded by the fact that ARPA-H is a new agency. So we're growing, but we are still kind of, well, there are challenges with that as well. So we have the research challenges with trying to do new things in a space as sort of a newcomer, and the additional challenges of having to set up our own infrastructure, our own culture at the same time. So there have absolutely been challenges, and will continue to be. But I think that's just part of the ARPA reality.
Okay, well, can you tell me more about the agency's collaborative effort with DARPA when it comes to expanding the Artificial Intelligence Cyber Challenge?
Absolutely. So as the program manager for AICC at DARPA, I have the honor sort of working on the program on behalf of both agencies. And we pursued this collaboration when we sort of saw DARPA's focus on critical infrastructure as a major, so AICC, the AI Cyber Challenge, is a 2-year competition to create the next generation of AI-empowered cyber reasoning systems to find and fix vulnerabilities in software, source code specifically. The competition was designed to work on open source software, which is a component of much of our software ecosystem. And ARPA-H realized that as a representing a sector on our own, as part of HHS, that this was something that we needed to be involved in. This is something that we knew could have significant impact, and so we wanted to support it. And so it's been, really, really a delight to sort of see the DARPA and ARPA-H come together with this effort. And we recently completed our semifinal event at DEF CON in August. It was very, very exciting. That led us to a place where that event enabled us to identify our 7 finalists who will be developing their systems and competing at finals at DEF CON in 2025.
Oh, wow. That does sound exciting. And thank you for sharing the details about the collaborative effort with DARPA. Well, before we conclude, Andrew, I just want to know, are there any future cyber initiatives that you're excited to talk about?
I'll say generally, I think, there's so much to do here. Currently, sort of off-the-shelf tools, they fall short in detecting the emergent cyber threats that we have to deal with. And in healthcare, we unfortunately find ourselves on the receiving end of some of the earlier in the sort of development cycle. We can't rely on other people necessarily seeing the attack first, because we're hit so frequently and so prominently. So there's a strong urgency for us to do more in this space. I will say that I'm super excited to see what happens at AICC Finals in Las Vegas in August 2025. I'm very excited to see, we're starting to see more from our DIGIHEALS performers, and hopefully we'll be able to speak more publicly about that soon. And then Upgrade, proposals are due in early October. I'm very excited to see what folks have come up with as possible solutions, and then really look forward to kicking off the program in early next year.
Okay, great. Well, Andrew, I really enjoyed our conversation. And I want to thank you so much for your time and discussing the latest cyber initiatives going on at ARPA-H. I really appreciate it. And I hope that you have a wonderful afternoon.
Thank you so much. You as well.
Thank you for listening to this episode of CyberCast. We'll be back next month with a brand new interview in our GovCIO Media and Research podcast feed. But until then, please subscribe and leave a 5-star rating on the podcast platform of your choice. Thank you again for listening. I'm Nikki Henderson, and we'll see you next time.
CyberCast, along with GovCast and HealthCast, is a production of GovCIO Media and Research. To explore our content, visit our website, govciomedia.com. Keep an eye out for new episodes every Tuesday. And if you like what you heard, leave us a review on the podcast platform of your choice. Have a topic you want us to discuss? Contact us at newsletter@govcio.com.